Edit later, I'll start now. Please. All right. Everybody here? Okay. Is everyone here? Or someone still in the kitchen? Okay. Okay, awesome. Thank you so much for coming. I really appreciate it. It's really awesome that you're here. I know there's so many other things going on, and I do appreciate that you're making the time, to learn about sort of future of neurotechnology and all these kind of things. So to get started, we'll start with Tim here. He's our host from Cloudflare, and I'd like to give him a few minutes to talk about Cloudflare and whatever he likes to talk about. And then I'll go after him.
Fantastic. Thank you. Welcome to Cloudflare.
Thank you.
Thank you. Have you been to the Cloudflare office before?
Yes.
Excellent. Welcome back. So there's a couple of things that I want to point out. There's some washrooms here. There's some washrooms in the other space. There's lots of snacks and soft drinks. Please make yourself at home is the kind of the primary thing. At Cloudflare, we talk about we're building a better internet, and that's why we have neon that says we're building a better internet, just to remind us every day that we're doing that. But one of the things about this space is that this space is available. So if you'd like to use the space, there's no charge associated with it. We encourage folks to use it. It's used primarily for a lot of tech events. This weekend we have a hackathon that's coming up. We're also doing a lot of public work, public affairs work too. So we're doing work with San Francisco General Hospital is going to be hosting a private event for their birthday party. So it's available for all types of space. But the primary message there is make yourself at home. At Cloudflare, this is my side gig. My day job is working with community.cloudflare.com, where we do most of the support for Cloudflare customers on a public community. And so I spend my day answering questions about Cloudflare all day long. Like full stop, that's my reason for existing. One of the things that we've done for tonight is we've taken the questions that most popularly come up and we put them onto QR codes. So there's a bunch of QR codes on that pillar right there. Scan the codes. They kind of are self-explanatory. Are you interested in joining Cloudflare? Are you interested in using the space? Give us feedback. So it'll answer a lot of the basic questions you have. I'm going to be with you for the course of the event, so if there's questions that come up, please feel free to ask me. And with that is like following the first rule of public speaking, and nice guys finish fast. So we'll turn it over to Link for the main event. Thank you very much.
Thank you.
All right, cool. I guess we'll start. Okay. All right, so I'll just briefly, as a first step, talk about what we'll do here this evening. Since you all came here in person, again, I appreciate that. So the goal of this evening is basically to get together and also to learn about what people are working on. So after I finish my talk, I would like everyone to come up here if they like and speak about what they're working on or ideas they have as it pertains to neurotechnology. And then basically we can all sort of learn about each other. And then hopefully after that we can have more like a square where people just basically talk to each other based on their interests. Yeah, all right. So what we'll be talking about today is basically the future of neurotechnology, of consciousness, dream explorations, technologies, mental health in general, why this is a problem, why we're doing this, and yeah, that's what I'll be talking about. Okay. All right. Yeah, I've lived like a monk, so I haven't talked in a long time. So I'm trying to be quick myself, I haven't.
We met and you had some, I don't know, remember I was grabbing the water and then you started talking about your company and what you're doing with your company.
Yeah, so I mean, we're working, I don't want to make it about myself or like my startup, but I mean, we're working on like dream exploration technologies. That means I lose a lot of people instantly when I talk about that because it's a very esoteric topic. But I do think it's important to acknowledge the future we're building here. And also, for humanity, it's important also to build introspective tools, right? I mean, we'll also focus on outward material world, but there's something that's inward that's just as real. And all the mystic traditions have talked about this. And so I think it's very important that humanity also builds tools and technology sort of to introspect, because mental health is such a big problem in society, right? I mean, here we have our friend Matteo, right? He worked on mental health as well in the past, right? There's other people here also working on different things, but yeah, I think it's just difficult because people don't really take mental health and sort of the mind science seriously, right? But I mean, if we're looking from a historical perspective here about the mind sciences, we're looking here at a point where sort of like we're still waiting for like Galileo, where we need a new telescope to explore the nature of mind. You know, I talked about sort of dreams, and dreams sort of are like the perfect laboratory to explore the nature of reality, the nature of mind. I mean, these are all things that are sort of embedded in science now, so it's all kind of real, except most people don't realize that. And so, yeah. So I'm not trying to like sell you something today, or make it only about myself, but I do wonder how we can also make sure how people can, how we can just focus more on sort of this inward revolution, which is difficult. How do you get that started? You know, but I think with all the advances we have in neural interface technology, with generative AI, it's really important. Like I said, mental health is such a big problem. You know, I mean, take something like depression, you know, or people who have PTSD, right? It's a really important problem that we need to solve, because right now most people just take pills, right? Most people, they have to talk therapy. So there's not really like a new paradigm that we have that people can really use to free themselves. So I guess what I'm trying to talk about today, after I stop being nervous, is like, how can we sort of be free from our own minds, right? Because at the end of the day, we're all sort of on the same journey, and reality is really more magical than we realize, you know? And like, in some ways we're getting distracted with all these things that are happening sort of on the physical material plane, but you know, Bill was mentioning, you know, even like the waking state is already like a waking dream that we sort of inhabit, right? So it's really important that we sort of also dedicate resources to build towards this sort of new frontier of the mind sciences, because we don't know much about the brain, right? And we don't know much about consciousness. We don't know much about the reality, sort of like the fundamental reality that we all inhabit, right? And Katie was talking about NDEs and like other type of like realities that we can access, but most of the time you talk to people about this, it's a very esoteric topic, you know? Most people don't take you seriously, but it's not gonna be enough just to go to other planets, just to like go outward, you know? We also need to go inward, and people need to take it seriously, because it's not just psychology, right? I mean, like I said, mental health is such a big problem in society, and like we really need to figure out how can we really sort of build new things. And like dreams, as I had explained, you know, are sort of like the perfect laboratory that exists in nature. We all sleep every day, we all dream every day. And they really have the potential to help us to see sort of reality from a new perspective, which I think is very important as we go into this 21st century, where all these technologies are accelerating, there's exponential growth of all these different things, people have more abundance, more things, but I think people are also just getting more mad, more upset, less happy, and I think we really need to also put some resources into like exploring our own mind. And in a way, historically, we've already done this for centuries, right? I mean, think about Tibetan Buddhism, you have dream yoga, think about all the Indian mystics, I mean, early Christianity. I mean, in some ways we've been exploring that for a long time, but it's still something like that right now people are not really taking seriously, and they don't see the value. So we really need to figure out how can we start a movement sort of for neurotechnologies, so people realize, okay, all of this stuff is also valuable. Because at the end of the day, I mean, can you imagine in the future when we'll be able to sort of have conscious dreams, like we're playing video games now? I mean, it sounds insane today, but I mean, this is all based on science, you know, and it's all where we're going with all these accelerating technologies. And so I would hope that we can also sort of make neurotech into this movement that we have right now in cryptography and AI, you know, where there's a lot of capital, where there's a lot of people sort of exploring all these different things, and people take this seriously, and I don't have to feel like a crazy person, and people don't take me seriously, and like, you know, I'm even nervous talking about this when this is like really valuable and really cool, like, you know, because at the end of the day, I think, like, I came here as a sort of immigrant, you know, from Europe, and you know, it's just a dream I have, you know, I'm just a human being, but like, I think, why not, you know? I mean, I think America is still great, like it needs to be more optimistic and reimagine itself, right? And so I think that's where dreams can help, and really having a new frontier where people realize, okay, like we're sort of also going into this new world, which is actually happening. Because I mean, like we're actually building like a world that's managed, or like not managed, but like AI is also building this new world. So we don't really know the reality that we're going into, right? So yeah. But most importantly, like I said earlier, like in regards to like mental health, you know, I think all of you can maybe like have people like that, or maybe also, I mean, everybody has some mental stress, you know, some mental loops that they're sort of trapped in, you know. Like Anika is also working on mental health, right? So I think like there's a lot of people also trying to push for the value of like mental health and giving people mental mobility, which I think is very important. Because it can't just be about more stuff, you know? Like, you know, if you're stuck in your own loop, like you can be stuck for years, you know? Like you can be stuck in a dream, but it's negative and it's bad, and like people suffer, like, you know, and some people like, a lot of people die from it, you know, and it's a pandemic that we have here with mental health, you know. Even the word mental health is very stigmatized, but it's like, how come, you know, if you go on Walmart, you can buy 200 spoons, and like when it comes to tools to help yourself be free from your own mind, it's so like we don't really have many things, right? We have meditation, you know, we have dreaming, but even those things are not really taken seriously. So we really need to figure out how can we, you know, start a movement for sort of like these internal, introspective tools, and like make neuroscience really valuable and seriously, because it is a real problem that we're solving here. Like, you know, when I talk to people about dreams, people think I'm building this Disneyland, but at the end of the day, this is about like, how can we use dreams to wake up, you know? How can we all collectively wake up so we can imagine a new world? Because literally that's what we're going into. Like if you think about all this progress that AI is doing, we can't really fathom yet, like, the world that it may build in the future. So yeah, so I don't know. I mean, that's why, you know, I brought people here together today to just like figure this out together, like, you know, because some of these questions we'll need to answer as a society, also like ethical things like that, we need to answer now. It can't just be like waiting later, like, you know. And we also need to figure out how can we have power so we can, you know, people listen to us, you know, and we can build these things, and like we're being taken seriously, like, you know, and it's not just like this esoteric thing, and like, you know, people don't want to invest their time into this because they don't think it's valuable, right? And so I think that just requires all of us to sort of get together and do this and like figure out, okay, how can we start a movement, and like, how can we start a movement and do this? I mean, you know, if going back into dreams, you know, lucid dreaming is a trainable skill, right? I mean, that's something that everybody can learn, just like meditation, but most people don't like to meditate, you know, and most people, you know, it's like they're sort of like, they're not even understanding what lucid dreaming is. But I mean, it's literally like in a lucid dream, you can be aware that you're dreaming while you're dreaming, and you can explore your own mind in a virtual reality setting. I mean, so that's kind of very magical. People, it's almost like unbelievable, like how is that real? But you know, since the 70s already in the West, it has been established as a science, you know, and you know, if you go back into Tibetan Buddhism, you know, you have like dream yoga and things like that. So yeah, you have a question?
Yeah, just two general questions.
Sure.
In the research you've been doing these past few years, like how close have we gone to like visualizing dreams using like monitors and stuff? And is there any kind of like language that has appeared in research for understanding kind of like the brainwaves during dreams?
Yeah, I think so. There's been a Japanese team that has been like able to like record dreams to some extent, you know. So there's been a few experiments here and there. But as it comes with dreaming, we still don't have sort of like the scientific neural signature why we're dreaming, or how can we lucid dream on demand, you know. And then also like it's not just enough to get people into a lucid dream state. We also need to get people then stabilized into that lucid dream state, you know. So these are all things like when the brain is still like very unexplored. I mean, now we have neural interfaces, you know, but most of the applications of neural interfaces at the beginning is going to be how can we restore motor function disabilities, as we've seen now with Neuralink, for example, right? Neuralink was able to like help someone with a motor disability. And so like, you know, then talking about how could you induce someone into a lucid dream state requires consciousness, you know? And so it's like, well, how can you hack into consciousness? It's a harder question to answer. But I mean,
there are actually a couple of, again, there are pathways, again, where definitions vary, but physical state of consciousness has been very well studied.
yeah,
So, I mean, technically, anesthesiologist controls your state of consciousness.
right.
That we actually repeatedly do that in a operating table on how they control your states of consciousness and then how that correlates, and then how can you hack those conscious states. So there's also a parallel understanding of your REM cycles of sleep to what state you can actually get there.
Right.
But the question is, can you do that without external intervention on your own, on
Yeah.
demand? Is an entire modality of trying to achieve, meditation is like one of those deep ancient techniques that people use to kind of get into that on demand, but that requires intensive training. But through the fields of anesthesiology and other physical neuroscience, states of sleep, states of consciousness have been very, very well played with, and we have a deep understanding of how that works from both a medical and non-medical standpoint.
Yeah.
Although I would say, my voice is gone, but with anesthesiology, I think that it's a bit more, it's sort of like, are you conscious or are you not? It's in other words,
Or
are you
controlling to
feeling
what
pain?
level you can control their wakeness or states of consciousness.
Right. No. So I agree with that. I guess. But I think what Link is talking about also is sort of like in the realm of where you're conscious. There's a whole range of ways to be conscious. I think that maybe what you're sort of.
Yeah, so I mean, you mean, so what we're working on, I mean, I wrote a white paper.
Oh, no.
No, but it's good thoughts. I mean, also we want to make this open, I mean, this is the idea to have a dialogue with other people, I don't want to just stand up here, just talking about this, but I mean, I wrote a white paper in 21 where I suggested we can create virtual dreams with brain computers, and we'll build it open source. But that's insane vision, turns out, and very hard. Now there's more people building tools for lucid dreaming. I mean, since it became a science in the 70s, more people have built technologies by which you can have experienced lucid dreams, or how you can meditate better. There's a Muse, there's different devices. And so what we're working on is more like a neural link for consciousness, sort of how can you explore consciousness? How can you explore the nature of your own mind? How can you explore nature of reality, right? Because I mean, the waking state is just one plane of consciousness, right? And there's so much more, and we don't really know. And with AI is actually a great tool for us to then use all these things to actually explore what reality is about, and regard sort of reality as more magical than we think it is, because right now people don't even really pay attention to waking state, I mean, most people are just rushing and what's next, and they're already living on the internet in a way, on the computer, on the phone, and all that stuff is good. We can keep doing that, but I do think it's important that we also appreciate that there's more magic to be found in sort of reality itself, and given the state of mental health in society, and especially Western society, we really need to figure out how can we build tools. I mean, like I said before, that are effectively helping people to become free from themselves. And that's a problem that most people have in Western society, and it's not going to be enough for one startup to do this. This is basically a new ocean that we're rediscovering. We're kind of rediscovering the world map, and we really need to figure out how can we start a movement, and sort of like I said, similar to crypto AI, how can we have a forcing function where there's capital and people exploring this and building tools and building things for this to exist. Because the vision that I have, where during the day a kid could play into their dreams I was able to play a video game as a kid, that will require way more advanced technology than we currently have. And so we really need to figure out how can we accelerate neuroscience in terms of having more technology, but also in terms of ethical stuff, how can we make it open source, how can we make it, how can we answer some of these questions in a reasonable way, and it's not going to be a company trying to control all these things, right? And so, I mean, doing a startup is hard, but creating a network is even harder in that sense, right? And like something like this where most people don't take you seriously, like, you know, where some people like, they want to see the proof, and they want to see like, you know, like some inception device that I can deliver, but like, the reality is it's just like very difficult to sort of to build even in this kind of sphere of like consciousness, because people don't take it seriously, people don't value it, you know, and like even though like mental health is such a big problem, and so that's why I hope like we can really come together more, and you know, obviously the idea is not just to do like a meetup, you know, do conferences and talk about it, right? The idea is like sort of early Ethereum where people would come together and like be aligned towards building something, and then taking that energy to really sort of build tools to heal people, and not where we're healing people, but actually people can heal themselves, you know? And I think, I mean, I can speak just from my experience, you know, I've been trapped many times in different mental loops, you know, outdated narratives, false beliefs, you know, certain things that really keep me stuck and limited, you know, and as a result then, you know, I'm like trapped and I'm sort of imprisoning myself, you know, and I mean, that's really bad, like in many ways. And like, I think it's freedom is important, but freedom is also the freedom, the mental freedom, the freedom from the mind. That's so important, like, you know, and so really like, that's why I try to talk about this, but now I've been talking about so many different things, but really the main mission is here, like we need to put more resources into like humanity investing into like these technologies to be free from the mind, like, you know, because this is even more advanced than all this brain computer stuff, I mean, I love, we should go to Mars, you know, I mean, Elon Musk is great, like reusable rockets, but it's like, there's something about also reality, like I said, that's so magical that we shouldn't forget, you know? I mean, like, it's hard to like pinpoint to this, you know? It's like an invisible world, but I mean, it really does exist, right? And with all these tools now that we have, we'll have more and more confirmations that reality is not just like only the waking state, right? And I think dreams are really powerful, you know, and it's like, you know, people think about dreams like, you know, oh, it's like a wish, you know, I wish my dream is to be this or that, you know, but like a dream is really this neutral format that exists in nature, right? I mean, everybody sleeps every day, everybody dreams every day, even though you don't remember. And like, you know, in a way, like, you know, people are so obsessed about waking state and like, you know, making sure every minute is like optimized, like, you know, for all these kinds of things, and then people just like go to sleep and like charge a battery, like, you know, it's like really like not really seen as valuable in that sense, you know, and like, you know, with advances in generative AI and neural interface technology, we'll really have the tools to do this, but if people don't care and don't put the attention to this, you know, then like, how are we going to reinvent ourselves? How are we going to reinvent humanity? Like, you know, like it's like humanity is not going to go away. We're going to like, you know, merge with AI, but like in a way where we can retain the humanity, like, you know, and where we can retain what is human about this, but we need to also be creative about this and like wake up, you know, and like it can't just be putting more, it can't just be only about technology. It also needs to be about consciousness and realizing that sort of nature of reality is really more mysterious, like, you know, than we attribute it to. Yeah, so I mean, that's why I thought it would be good, you know, the Bay Area, America, we're still living in an American empire. You know, this is basically the place where most tech people are, like, you know, convening. So this is where we need to start this movement, you know, and really make it happen, like, you know, and it requires a lot of different people, like, you know, and I mean, I'm just one person. I mean, I don't know how to do all of these different things, right? And I don't want to make this about myself, but like my own story of like, you know, suffering from all these mental health stuff, like really makes me feel confident that it is important that we solve these mental health problems that people have, and especially younger kids, younger like generations of children like are suffering from this because they were born on the internet, born with these phones, you know, and they don't know how to deal with this stuff, like, you know, so we really ought to like put resources into like exploring sort of nature of consciousness, you know, so we can be actually free, because freedom is like very important, and this country is supposed to be about freedom, like, you know, and in some ways we've forgotten that, you know, and so just because you can't touch it yet or you can't see it yet, it doesn't mean it's not real, right? I mean, we even have scientific proof for this, and so Silicon Valley, most investors here, it's going to be very difficult to convince them, as I've attempted, you know, to convince them on this kind of vision of like basically virtual dreams, right? In a future where you can basically have an inception device and you can have basically conscious lucid dreams during the daytime, right? I mean, that's like, not really taken seriously, like, you know, and it's hard to also get government funding, you know, because that's really usually focused on very specific, like, problems. Yeah, so, you know, I'll just keep going and keep figuring this out, but we also need to, like, move faster and make progress, you know, and, like, unfortunately, I mean, the world is what it is, you know, it's easier to sell people drugs or sugar or things like that, you know, and mindfulness and meditation and things like that, it's just much harder to sell. You have a question?
Yeah, more of a thought.
Sure, yeah.
Let you breathe.
Yeah, I know, yeah.
Yeah, so thanks like for doing this. I just from my own experience, I'm not Neuralink expert in any of that. But even just as somebody in the crowd, in the 90s, worked as part of the team to build devices for brain surgeons to help train them. So back then it was, what was the limiting factor? You can't train on real people, right? So they started using the 3D printers to create the brains, and then the next part is the devices to like cut them. Each brain is $10,000 to print back then. And so then it started to get all virtual, right? So can we make devices where we actually took an SGI computer and took what you may have heard of it, called an immersive desk, which is a type of virtual reality device where it's life size and you're looking at a bent screen. It's like totally old school now, but you could play Doom on it, right? So we took those devices to make it with the scalpels, right? And then it's kind of like the next thing, like visualize doing what you're doing. And then from there, it went to alloys, right? So you could take an alloy and memory-shaped metal, right? And so like instead of just holding an actual thing, you wanted texture, right? So the texture is you're taking this scalpel and drilled through electrical signals, it makes your hand move like you're actually hitting parts of the brain, right? And this is back in the 90s, and I'm sure people were thinking about these things beforehand. That's just like the physical devices, right? And then you've also got the whole AI in general, right? Neural nets, this modeling of the neuron and how does that look like in code now, right? They started that at Dartmouth in '56. Right. And now we're in 2024, and people are starting to still see that model in code, right? Like it still works, right? So we've gone to building hardware to replicate these things, right? So I think there's pieces in the engineering world coming together that might help us, like you mentioned, Neuralink and things like that. Then of course you've got all the other side of this, right? The regulatory and all these problems. My wife has a PhD in psychology. I hear about it all the time, about what a pain it is to work in California. As a mental practitioner, even though every school, every government, non-profit entities wanting people to help other people, and yet there's so much red tape, nobody can do anything, right? And what you're kind of talking about, at least to me, is on that continuum, right? I can empathize with how hard this must be to move this forward, right? So I think
yeah, it's fucking insane. Every day keep pushing this, like, and people look at me like I'm a crazy, insane person, like, and I'm also questioning my own sanity, obviously, like, but the thing is, it's going to happen, like, because throughout centuries, people have accessed different types of realities already, and like lucid dreaming is a science, astral projection, NDEs, psychedelics. There was a huge push in the 70s in the United States to like do more like research around psychedelics, and then it was basically like temporarily like suppressed by the government, and now it's coming back, and I think something like psychedelics is like potentially quite powerful, but we have to also be really secure and safe about this, because we're dealing with people's psyche and with people's minds. This is really like difficult territory to deal with, like, and it's hard, and so it's like we can't be like crypto AI people, just go as fast as possible. Like, this needs to be really secure and like sort of more like SpaceX and Tesla, where it's like all about safety and security. Like, obviously we want to make progress, but we need to also keep ethical questions in mind. We need to keep like safety in mind, and like it's like right now people don't even take really us seriously, like working on introspective tools. Like, this is more advanced than brain-computer interfaces, which says a lot, because neural interface technology is also quite magical at what it can do. This is consciousness, which is like very deep. deep, like, you know, and it's real, and it's like important because like the mind is really like transformative in its ability to like assume different shapes, to like torture yourself. It's infinite possibilities to torture yourself, you know, and to like create all this havoc and all this chaos, and like it create instability in your own mind when like you need to be at peace with yourself. And like, you know, why don't we have more tools for that? Why don't we have more tools so you can be free, like, you know, so you don't have to suffer so much? Because most of it is like you're creating your own suffering, like, you know, you're creating your own pain with all these different narratives, with all these different belief systems we have, you know, and things like that. And that's why at least it's hopeful. We have psychedelics, you know, and we have meditation, we have lucid dreaming, we have conscious dreaming, like, you know, but it's like still like, you know, Elon always talks about how there's not enough funding in space exploration. For dream exploration, it's like, nope, nothing. I was at NASA, people like even laugh at me there. Like, it's like no funding really for this. I mean, it doesn't mean, of course, people are working on this, but it's like, it doesn't really exist as an industry, like, you know, and most of the neurotech stuff, it can't just be about making people more faster and efficiently stuff. We need to also use neurotechnology to like allow people to heal themselves, so we can actually heal from trauma, we can face anxieties, we can face fears, you know, and deal with all these kinds of things. Another question?
Yeah, to that, the bigger, faster, stronger take, right? Like, that's very quantitative. I think that's why it's easier, right? People be like, do something, you can stay awake, you know, super soldier, right? You're up for 24 hours kind of thing, right? But then, you know, the healing aspect, right? That's much more personal, subjective, right? How would, you know, from an outsider, like, I wouldn't even know how to do that for you, right? And then that's, I think.
Yeah, but I mean, yeah, fair enough. I mean, that's part of the problem, that we don't measure some of these things yet, and we can't really measure it yet, and it's too subjective, and so then it's like difficult to build something around that. But I mean, like, you know, I think we can definitely measure if people are healing. I mean, pharma sells all these drugs to keep people dependent for the rest of their lives potentially, right? And they're not really healing people, like, or like solving the problem. They're just attacking the symptom, like, you know. And talk therapy can also be useful for people to cope with, and like, I mean, we do have a lot of things, obviously, but like, I think like there could be way more. And I think for a lot of people who have like some mental health dispositions or disorders, I don't even like to talk like that because it makes people like seem as if these are the weird people, but these are just people who have like other ways of perceiving reality. And like, it doesn't mean they're like not normal or whatever, it's just like, so they need to also deal with being in this reality, and how can we help those people, or even normal people as well. I mean, normal people like to say they're normal, but like they're also stressed out, you know, and they don't really know sort of like how to like calm down, you know, and like relax, you know, and I think all these things are important. Like, you know, how can we find peace with ourselves, and like how can we have more tools like that? I mean, go on Amazon or Walmart, you know, there's all these different tools for everything, like, you know, which is fine. I mean, we can keep doing the exploration of sort of like the physical material world, which we've done since Galileo. I mean, that's all fine and valid, but I'm saying like there needs to be also sort of this revolution in the mind sciences, because it's all sort of based on reality. Yeah.
There's actually a lot of fascinating work already happening. The definition of tech is beginning to shift how we even explore, right? Because technology does require quantification. We want better data. We're trying to gather that never been gathered before. There's the intersectionality of AI is enabling better discovery of what these states are, right? Because oftentimes, that's why, like, when you think about brain, there are three different distinct concepts. There's consciousness as an independent concept that we don't have a universal understanding. Like, many camps, you know, differ. Valid arguments, but there's no common understanding. From a spiritual realm and, you know, quantum mechanics and like in 26 dimensionality of physics, string theory, there's just a lot around that, purely as states of energy and frequencies. And there's another one is the physicality, which is really more what we consider the medical definitions around states of consciousness, like states of awakeness, and then how do you control that, and then how can you manipulate those states for a variety of reasons. But there's also other aspect of is, let's not even focus on the biological biochemistry composition of the brain, but rather focus on the computational nature of neural networks. So there are 100 billion neurons that our brain contains, with a trillion synaptic connection possibilities, which is where psychedelics is becoming quite fascinating in terms of how it can activate, like, you know, substances like LSD, microdosing, on how are the synaptic connections happening, and once those synaptic connections can be manipulated or manifested, then it unlocks variety of brain centers, and then there are technologies with like, the helmets and like, medical, non-medical, like, invasive, non-invasive, like, entrapments that you're wearing that are beginning to like stimulate, say, if I stimulate that neuron center. But the question is, how much do I understand what neuron center is contributing towards those loops, towards those conditions? Some, of course, medical conditions, some are just perception plays. So there are actually fascinating like lab-based tests already proving where if you, for example, like the concept of pain, if two different mice, if one mice is experiencing based on a context of environment, and as a result of that has information layer, which is memory. Memory is nothing but an information layer that our brain basically stores consciously, subconsciously, means that is what triggers my next behavior, and can I artificially transfer the same memories into another mice who's never experienced it. So we're already playing with, can you remove the memories as in effect, because we are transferring of the information layer, and then how that would benefit again from a healing modality.
Right.
So lots of like really fascinating work is actually happening. Definitely I agree with you. I don't think it's a
It's not
large
movement,
scale.
yeah, right? Yeah,
Yet.
we need to figure out how can we create a forcing function so there's a movement and so there's capital, because we still live in a capitalistic society, and like it's questionable also a lot of things that are happening in AI and crypto, what these people are doing. A lot of them is just speculation, which is fine, but like it's like we can't just like have no funding into neuroscience because it's not real, or because of like we need to just figure out how can we get more funding into this, and so we can also experiment more. Hopefully we also need to figure out how can we maybe create a virtual brain or something, the advantage why crypto took off is because in the real economy, you can't just like experiment in the same way. You could now deal with sort of a EVM, or some blockchain system. It's much easier to experiment there, right? So we also need to figure out how can we experiment in a safe and secure way. But also, we need to figure out how can we get more funding into this, so all of this is also taken more seriously, and then there's also more capital, and then we can sort of start this movement. Another question?
I think to that point, clearly funding always helps.
Yeah.
Do you see a particular problem of lucid dreaming and all these things, right? So to the untrained person, it would be overwhelming. Right? Like where I need to hear a tactical area, hey, if we maybe target this or this or this, people will start to focus a little more, becomes a little more manageable, and they can actually something able to be funded, something that actually has an outcome that is reachable.
Right, yeah, it's a good point. I mean, obviously, it's very abstract when I say, we need to build new modalities by which people can heal themselves. You can think about someone who comes back from the war, has PTSD. How can we help those people? How can we help someone who has a trauma? How can we help someone who has anxieties, nightmares, insomnia? There's all these kinds of things, right? But I think it's it's going to be difficult to just go out there and promise, heal people. It's then it's going to be very regulated industry, So we need to start this more playful, where how can we do this in a way where it can create mental mobility without the expectation that it will solve these problems, because to solve these problems we need more advanced technology, and then we'll need more people guiding people, and before we can have the expectation of that, But I think it's just we just need to create our own economy here, and figure out how can we basically fund this, and the US is unfortunately still not very clear how you can use different mechanisms, to do that, and Silicon Valley is very not interested yet, in funding this, and so it's I'll keep funding this and I'll keep going, but it's just we need to go faster. Another question?
Could you help me to understand what is lucid dream?
Sure.
And then, what are the applications of lucid dream, commercial application?
I mean, so lucid, you want to say it? Or?
I can talk
Yeah, you
about
can talk about it.
So, when you go to sleep,
Imagine I'm the least knowledgeable person about lucid dream.
so, but do you
Try to speak up for the camera.
I won't be able to talk too much louder. Do you remember your dreams ever?
Sometimes, yes.
So, really, a lucid dream is as simple as while a dream is going on, when you're having a dream, you become aware that, wait a minute, I'm dreaming, but you don't wake up. So that is what a lucid dream is. It's becoming conscious of the fact that you're having a dream, while the dream is going on.
Am I able to manipulate
That's the next
Not,
level.
not necessarily, not necessarily, so that, but the,
But that's the next level, actually.
Yeah, you can.
Lucid dream, the first stage is sort of like, okay, I'm dreaming, I'm aware of it, and then you know, some of the weird dreams you're having, right? You're like from one place to another, you're like, wait a minute, I want to go there, and then you're there, and you're still sleeping. So that's kind of like the next stage of sort of awakening is what you're talking about, right? And what you were actually touching on as well, different levels of awakening. And when you can manipulate that, that's when you're sort of like on the next level. And then after that, I'm not sure, but what's the application of that? That was a great question.
Yeah, I mean, there's been a lot of research. I mean, for example, athletes have been using lucid dreams to basically train themselves in their sleep, you know, so you can recreate the training environment. You know, there's studies where depression, you know, essentially like in a lucid dream, you're in a safe environment of your own mind, and if you're regularly able to access that, you'll be more able to like also experiment with certain like mental patterns that you have, and then heal yourself in some sense, you know, and realize, I mean, similar applications like to psychedelics, right? I guess people do that for all different reasons, but like in a medical environment where people use psychedelics, the idea is to like get people into an alternative state of mind and then basically help them to realize something from which they're really suffering, like internally, you know? And like it's really hard for those people to really realize that during the waking state. And in the psychedelic state, even though it's an hallucination or temporary or whatever, you know, it can be
Also,
very...
actually,
Sorry, Bill hadn't finished. Sorry.
oh, that's okay, no.
Also, leading scientists, and lucid dream is a state a lot of deep thinkers, scientists achieve problem-solving capacity, because again, it goes back to understanding your synaptic connections of your neuron centers. If you're able to activate without having to wake up from that state of rest, right? Which is, I think, really important. Is you're still in the state of rest. You're not active. You're accessing the subconscious, but subconscious, again, there's information layers. Again, there's memory and information systems.
Right.
That's why computationally you have to start understanding what the neural network really is, which is why we're building artificial neural networks. So we're doing this capacity outside, that's the AGI AI pathway. But means once sometimes those synaptic connections happen, it unlocks creativity. So which is why a lot of people try to practice. It's not easy because sometimes it can throw you off, it has to be administered. You have to really learn the technique in a natural way of getting there. So that's why I think the point that he's making is, can we actually have tools where you can get there on demand faster, right, so you're able to unlock your true brain power.
Yeah.
You know, this general statement, hey, you only use 10% of the brain, is basically that.
Yeah.
It's not that we don't have the neurons, we just don't activate all the neurons to be able to leverage the brain power.
Yeah, because
that we
basically,
have.
yeah, the psychedelic, I mean, literally, lucid dreaming is a virtual reality psychedelic, and in a psychedelic, basically, the default mode network is turned off temporarily, and as a result, basically, your neurons can connect with each other in ways that they normally don't. And then basically, it's a general purpose problem-solving machine, right? I mean, Kurzweil talks about how he uses that for that purpose as well. It's just like difficult to access, like meditation. It's just like not the world we live in at the moment, but like it's definitely a learnable skill, both meditation and lucid dreaming, you know? So it's like, okay, how can we make it more playful? So how can we have a cultural shift and also make it more feasible for people to access these different types of states? You know, some people call them jhanas, but the point is, like, at the end of the day, the point is not to get high. The point is not to be in a psychedelic and be in this window or in a lucid dream. The point is to be free, right, and move beyond the dream. But for that, to realize that, you need to be sort of experiencing that on a regular basis, you know. And right now, I mean, psychedelics are mostly illegal in most jurisdictions, so there comes some, you know, lucid dreaming is not that it's not that widely used, you know, because it's still stigmatized, or like, you know, people don't think it's real, and then people don't value sleep and dreaming generally. But yeah, it's literally like whatever you want to do, you know, whatever people pay for all these kinds of experiences in life, you know, you can do in a dream. Obviously, the goal is not to be in the dream world, you know, and they'll go dreamer within a dream, you know, but like the goal is to be free from basically the things that you are suffering from. And I think everybody, if they're honest with each other, is suffering from some mental modality. Another question?
Yeah, this is just a question. Why is this lucid dreaming machine actually the solution versus like a brain OS interface?
Yeah, no, I'm not saying lucid dreaming only. I mean,
Examples
Oh,
here,
okay,
yeah.
got it.
like
Yeah.
like that, and there are many things which are not accessible as well.
I mean, I'm positioned, yeah, right. Well, I mean, I think generally speaking, like, lucid dreaming is one modality, meditation is another one, psychedelic is another one, you know, but I think we can really program different experiences by which you can basically see yourself from a different perspective, you know, because dreaming is like a 4D experience. When you're awake, you don't have a 4D experience, you know? And like, you may know certain things, but are you really embodying them and living them? It's hard, you know? I mean, like, to be free from yourself is really difficult, and like, to be present in the moment is hard, you know? It's like, easy to be trapped in the past or in the future and think, overthink, overanalyze, be traumatized by something, don't let that go, and like, these things like require a lot of work, you know? So it's like the best thing we can imagine is a medium that you can access while you're asleep, or you know, while you're temporarily like outside of your waking state experience, and basically in a safe environment, right? And like then use that basically for different things. I mean, everyone has different things that they sort of limited by, but it's like I think everybody would value from like being free from that. You know, I mean, otherwise, why is the pharma industry making so much money? You know? They're making so much money because people are suffering. People don't like to talk about this, you know. In Asia, like even mental health chatbots are more popular because it's stigmatized to talk about this to real people, like, you know. So it's like, but I'm not the expert, you know. I don't know how to. I'm not gonna stand here and say I'm gonna like build something to heal everybody, like, you know. It's really you need to build like an operating system, and then people can build tools, and then there's experts, and then people can heal themselves. Most people know how they got into the prison in the first place. They have the most information about that, you know. But it's like it can't just be like waking up, going insane until the end of the day, and then go to sleep, and then keep going until you die. Like, I mean, what is this? Like, we need to like relax and be at peace and like, you know, be creative. You know, how are you going to be creative if you're just going to move like a mad person through life all the time? Like, you know, and most people like that. Like, you know.
I think there are like both. Healing is a natural outcome one can benefit from, but
mobility.
Like, but the idea is like there's so much untapped mental potential right now that's trapped because you're not able to leverage.
Yes, exactly.
Convert, and that's why I think, in fact, digital now, like in UK as well as in US, it's already legal. In fact, the first company that went public with an FDA-approved drug for anxiety and PTSD is a video game system, so it's no longer a compound. Right. In fact, more and more as we are approaching the future, we will get away from the chemicals.
Yes.
Because there's no way to target, there's no precision in chemical that goes into your bloodstream. While it's targeting a bad tissue, it also damages your good tissue. So precision is not achievable through, you know, the traditional pharmas. Already the pharma is getting changed, where you're now saying that, hey, a video game system is actually San Francisco based, neuroscientifically proven, FDA approved, which now you go to a psychiatrist, literally a psychiatrist prescribing you, but the psychiatrist is not the same person who's trained on chemicals. It's a new type of psychiatrist, means new degree altogether, where they literally say, okay, play this game 15 minutes, every 2 days, 6 months, you're done. And they're able to quantify. So I think like new modalities are emerging.
I want to ask you, does ultrasound play a role?
See, I don't know, but I think it looks like there's a lot of interest in
like Dopplers,
technologies, the Doppler.
Does that do anything to the brain?
I personally don't know much, so I'll be the wrong person to comment on it. But I do know there's a lot of exploration of different methods, particularly in understanding. Their scanning is one aspect of it, neuroimaging is another aspect of it. So it means more information we are trying to target. That's what like the PCIs are able to give you. Now instead of me trying to like understand neurons, I'm actually measuring your gamma frequencies, your alpha frequencies, and then how do they correlate? How do I even capture that?
By the way, if anybody else wants, at this point, since
Yeah,
if anybody else wants to say anything, please feel free, because like, we don't want to just make it where I stand here and talk, but like we can do it for a little bit longer, and then we can just like anybody can come up here, or we can just talk, you know. But like if anyone feel free to say anything, like, you know, it doesn't have to be always the same people talking. So you had something you want to say?
I asked him.
Oh no, Katie.
Yeah. Are we gonna alternate going up there or no?
Yeah, at some
Or do
point.
we
Yeah,
wanna be in our seats?
yeah. I think we can do that.
Does
at
anyone
some
else
point.
want to speak, or?
So,
I've
been
just,
picking-
and I'll go after you, because I have a lot
Maybe
to
let me
say.
just wrap up, and then
Yeah.
we can do that after that.
so I've been picking different things from different people, and so I think that
one thing that I wanted to, I obviously had like ideas of how we wanted to promote this and create more awareness
Right.
to get the movement started. And then as a creative who's working in pharma, so we deal with like a lot of like PRDs, like product requirement documents, which the clients require, oh, we need this on the screen, we need this on this user flow. So before suggesting the solves, like some of the potential solves that you think would work best, I wanted to ask you, coming from a different culture, how much of awareness do you think about neuroscience or neurotechnology does US have, and that in general for like regular people, not like who are researchers or who are clinical researchers or clinical trials that are being happening in the space, but it's just like for common people, like how much of the people in your research, I know you have been researching on this like for a long time, and so
Like how much do ordinary Americans know about?
yeah, the awareness like of how much this is important and how much this people are actually suffering.
Well, I mean, I do think you can measure how many people are suffering in terms of how many people take these different types of pills, you know? I guess we're living in a society, especially America, where most people, it's easier just to like try to escape from it or, you know, deal with a symptom and then take a pill or do something like that. And so I'm sure there's like also people who are more aware of this and trying to find more holistic ways to solve this. But again, I think the whole idea is like, how can we build a new paradigm other than pharma drugs and like talk therapy, and how can we build something that people can basically then use to heal themselves, you know, especially with things originating from the mind. It requires sort of like a different approach, I think. And that's where dreams, you know, and meditations, you know, and psychedelics, and really we can reinvent different things, you know, within that as well. Like, you know, I mean, I pitched like virtual dreams in 21, you know, you can imagine programmable dreams in the future. I mean, this will all happen, like, you know, but like I think it's also important, how can we use that also to give people more mental mobility, like, you know, so the goal is to like, how can we create like an automobile for the mind, you know, how can we basically like give people in the same way how people take, you know, a plane or a car or like, you know, a train to go somewhere, they don't walk everywhere. Like, how can we give people this automobile of the mind so they can, in a safe and secure manner, every day, explore their own mind and realize some of these anxieties, fears, and things that they have, and some of these rigid thought patterns and, you know, false belief systems and things like that, and how can you like help them manage that better and like do it more playfully, and then basically get people more sort of stable in that way and more creative, you know, and more light, you know, and more happy about life and like not being so stressed out, and like, I mean, all this other stuff will keep happening, obviously, like, you know, I'm not against that, but I'm saying like, why is it that we spend all these resources towards all these things, and then when it comes to like exploration of the mind, we barely invest anything.
So that's a problem, right? So that's the problem we are trying to solve. And then to solve that, you know, we have mental health months that US definitely like recognizes and observes. And then maybe there's a way that we promote these kind of issues and problems during that month so that it gets more recognized.
Right.
And then another way I was thinking, a lot of like companies like do large scale like summits, like yearly annual summits, like talking about like different things and different stuff. So maybe we could do like someone like gathering, this is beautiful, like everybody has different rationals and different perspectives about how we can solve things. And
yeah, exactly. I'm not trying, I mean, like, the idea is to basically start a movement so other people can also develop their own solutions, and whatever people are already working on. I mean, there's people here in the audience who are working on mental health tech. So like, it's like, the idea is like, how can we start a movement so we can build an economy basically of the mind, and we can explore basically all these questions about consciousness and reality, which is already happening already. Like, obviously all of this is happening fragmented already, in the same way how the metaverse and other different types of realities have also been happening for decades, you know? The idea is just to like, how can we get this all together and unite people more so we can have also more capital, and then basically we have more resources to explore all these different modalities, like, you know? I mean, my dream is in the future you can have virtual dreams, and during the day, like Inception, you can just go into a dream consciously, and you can basically have a programmed dream, a guided dream, you know, things like that, right? But there's other people who have other dreams and other ideas, you know, and neurotech is a broad field, you know, but like, you know, there is a frontier beyond space, and there's a frontier beyond the brain, which is the mind, you know? And I think that's what it's about. It's about basically how can we put more resources into that so we can have tools and technologies to build a new telescope to understand really these most important questions that philosophy has sort of asked itself for like centuries, and we can basically find better answers for that, you know? But if like people don't take this seriously and there's no money there, then like it's just like not gonna go. I mean, obviously there's already millions of people around the world, you know, in a population on Earth of like multi-billion people. Obviously there's millions of people like have explored their own consciousness, right? Their own like mental health and like, you know, their own like ideas about what it means to be conscious and things like that. But like, you know, it's like generally speaking in the Western world, you know, that's really not the focus, and that's not really like where we can really have access to different tools. Mostly it's like just deal with symptoms or escape somewhere, like, you know, and that can only solve the problem temporarily. So the idea really is to like, you know, how can we create a forcing function for more capital and people to build basically the neuro revolution economy, or like, and then, you know, we can integrate all these technologies that people are building, you know, through blockchains and generative AI and neural interfaces, you know, to really sort of build modalities and technologies by which people can reimagine themselves, by which people can be free from themselves. And like, I think this has like, you know, very specific value, but it does require like, you know, a lot of different people like coming together to do this.
Yeah,
you know?
I mean, like,
and I'm not trying to do like a meetup or a conference and just talk about this, you know?
Yeah,
And it's
absolutely. Like tying up with like Genentech and Roche, who are like really doing pan-neuro activities.
But this is the reality. I mean, like, I have been working on this personally, like on dreams for the past 7 years, you know, and it's like, it's just like very difficult, you know, because society doesn't, it's a very esoteric topic, you know, people don't believe in it, you know, and like, you know, outside Silicon Valley, people don't even like talk about, like, don't even believe all this tech stuff mostly, like, you know. And so it's like, at the end of the day, obviously, you want to have some proof of concept, but you also need capital for that, and you don't need people for that. And if you want to also then have principles and values like open source, that just like also requires a different way of going about it, you know. Yeah, I mean, I do think, like I said before, like, you know, it's basically based on science. You know, this is not some esoteric stuff here that we don't know if it's is it real or not. You know, like this is based on science. You know, and basically the journey has been going on for centuries for some individuals. Like, you know, and I think like in a time when there's like so much disruption and like sort of technology is accelerating so quickly, I think more and more people will try to look for ways to heal themselves. Like, you know, I mean, I don't think mental health problem is being solved at large anywhere, really. Like, you know, and like I think stuff like dreaming or meditation have been modalities that we've had for centuries. So why not tap into those and basically integrate all these different technologies into that and build, like, you know, basically some telescope that people can use on a daily basis, you know, in a safe and secure way, and then they can figure out the stuff themselves, like, you know.
So we're trying to create case studies that would empower and make people more empathic.
Studies or
like case studies, like
not case studies, but like the idea is like, okay, how can we build technology and tools, like, you know, they can basically demonstrate the vision, you know, and basically they can then basically get us on this path of building these things, like, you know.
She has something
Yeah,
to
sure.
speak.
Yeah.
Yeah, so
And I might stand at some point because my back is hurting.
Yeah.
But, and maybe I don't want this recorded, so maybe we could edit it out after,
Sure.
perhaps. I want to say it's not esoterical at all.
but let's like
yeah.
then talk not about stuff, because I don't want to edit all these things. So let's like finish the talk, I guess, and then
Yeah.
after that we can off a record and people can talk about other things that we don't need to report.
Should I end it?
So we'll just finish it here. Let me just say 1 minute, maybe
Yeah.
just like
Yeah.
Perfect.
Yeah. Okay. Cool. Well, anyway, thanks for coming. You know, and listening, and I know it's okay. You don't have to. Yeah, I really appreciate you guys coming here. Women as well, women and men, and like. Yeah, I mean, like I said, I think it's important that we sort of put resources into exploring the mind, you know, and all the things that can come from that. It's like, you know, basically modalities and tools that we can use to heal ourselves, and like reimagine sort of ourselves and the world, you know, whether that's like dreams or meditation or other things. I do think that requires some forcing function through which we basically have more capital and people sort of exploring neuro as a movement, just like crypto and AI. But right now it's not a movement like that. You know, obviously there's a lot of people working on neurotech stuff, but it's all very fragmented. So hopefully we can figure out how we can come together and really build sort of like all these different tools and explore sort of the frontier of the brain, you know, explore sort of like the frontier of consciousness and realize that there's more to life than just like the waking state. And so people in the future like will also dream more again, you know, and like, you know, value sleep more, you know, and value also all the things that pertain to longevity, you know, because we're going into an age where like people are going to live longer and longer, but like, you know, health is also about the mind and being free from your own mind. And so like I hope as we build these things, you know, we can also build technologies sort of to be free from our own mind. Yeah. All right.